In celebration of International Nurses Day today, NUS Nursing has immortalised some of their pandemic experiences. They launched an illustrated graphic novel depicting the experiences of a group of nursing students. License to Care offers an insider's look into the academic curriculum and training, centred on some tough subjects such as misunderstandings from society and family members. It also explores the many layers of care that nurses provide, as well as the joys and struggles they face. Well, for more, we're joined by Associate Professor Shefaly Shorey from the Alice Lee Centre for Nursing Studies at the NUS Yong School of Medicine, and Dan Wong, illustrator of the novel. Welcome, both of you. First to Professor Shefaly. Over the past 2 years, we have all come to learn and know and perhaps even experience the great work that nurses do. Why then is this graphic novel so important to still have?
Thank you for your question and thank you for having me here. First and foremost, I think it's an opportune time that we are launching this novel on International Nurses Day. Through this graphic novel, we aim to shed some light on rare perspectives of a nursing profession, which we believe that public may not be aware of. For example, our nursing students, they go through rigorous curriculum. They undergo many clinical attachments during the semester breaks. We have advanced practice nurses who can actually serve medication, and we also have mid-career switch individuals who are joining the profession. Most importantly, we wish that through this interactive novel, public can see the journey of growth and self-discovery that we nurses go through as we find passion and higher calling for our profession. Most importantly, like I said, that it's the International Nurses Day. It's our small tribute to nurses and nursing students in Singapore and across the globe for their selfless efforts, with the hope to create public awareness and appreciation for nurses and nursing students.
I can see that there is that education aspect of this book, perhaps even to reach out to sectors that you may not be speaking to now. But is there also a concern that there is maybe a remnant of challenges and people are not understanding the challenges and the abuses that this group of people face?
Yeah, definitely. Thanks for highlighting this. In fact, through the stories of these 5 students, we have specifically shared our experiences during the COVID-19 pandemic. I don't want to spill the beans, and because I really wish that public can actually buy this novel and can, read through this fun and, interactive way. But yes, we have showcased many instances where not only during COVID-19, even before that, when nurses undergo many psychosocial, ups and downs in their lives, including, as you have mentioned earlier, like, not getting a support from the family members and also from the wider community.
Dan, maybe it's a good time to bring you in now as illustrator of that book. It's a really stark departure from your usual style. I know you like the horror, the science fiction, you're inspired by anime. I'm wondering, how did you approach and connect with the contents of this novel and approach the illustration? Was there anything particularly challenging for you to draw?
Okay, thank you for having me. That's an interesting question. I feel like in regards to this book, when we were commissioned to do it by NUS, I knew it had to be driven in 2 ways. The first is content, the other is style. So in terms of content, research was definitely a big thing. We had to find out more about the profession and the various small details that those in the profession certainly know if we don't do it right. So we did research, we read a lot of articles about our profession, we joined forums. We also, through the blessing of NUS, managed to interview some of the NUS students who are actually in year 2 and year 3. And we got a lot of fun insight, a lot of fun stories, a lot of, let's just say that when nurses go through the crazy stuff, it already starts in school, because the student nurses, they actually go through clinical attachments to learn how to be a nurse. So they have been through their hardships. For instance, one of the articles that we've read, it talked about how when nurses or healthcare workers are during COVID-19, they don the full PPE. At the end of the day, they're hot and they're sweaty and it's extremely uncomfortable, and they leave like scars, the mask scars on their face. So these are examples of small details that we try to work it into the book. So that's for content. for style. As you have already said, I love anime, I love manga, and I think undoubtedly has found a way to naturally bleed into my work. So I don't think it's a conscious decision per se.
Oh, well, was there, I asked earlier, was there a particular aspect of this book that you found really challenging? Because some of the content, it's difficult. It's regarding a difficult topic. So how did you sort of approach that?
So maybe a good parallel I can draw is that, again, I can't give away too much, but there is a death in the book, right? And just like how the nurses in real life, they have to treat, somebody who has passed away with a certain respect, a certain degree of dignity. I too have to depict, the person who has passed away in the same manner, So I can get a small. It's not easy to do so, when I have control, I may not have control over the media at all times. So that's one of the challenges.
Well, I do want to thank you both because, from all those experiences comes a lovely product. So thank you for your input. I've been speaking with Associate Professor Shefaly Shorey from NUS Yong School of Medicine, as well as Dan Wong, who illustrated the novel.